Hello friends, myself Hitesh Parmar. I am Esoteric Architect and NLP Alchemist. You might find these terms completely new sometimes. Basically, the way I do architecture is very special architecture where I empower people for health, relationship and wealth. For that, I have integrated NLP, that's neuro linguistic programming, with architecture, right? So what I do is I program architecture or interior space. I also design or redesign architecture or interior or landscape or urban space, and I integrated NLP. So let me give you some introduction of NLP so that you can understand what I am doing. NLP is neuro linguistic programming. So we have lots of filters while we are taking information, and that is causing disease or discomfort or unresourceful state in our body and mind, right? So basically there are lots of filters like generalization, deletion and distortion. Also we use our meta programs to filter information coming in, and also we have neurological levels like beliefs and values and identities will decide what kind of information you will take and how will you take it, whether you will take it or not, right? So these are the things, and people think that NLP is actually very good at psychosomatic diseases or mental problems, but NLP is quite effective in diseases like corona, cancer, diabetes, thyroid. So basically, if you know how to heal common cold with NLP, then you can do anything with NLP because you understood how to use NLP, right? So basically what happens that actually, if we talk about corona, there are two types of patients, like people who have good immunity, like young people, and people who don't have cough, right? And people who have not so good immunity. So what happens here, when people contacted with corona, they got COVID infection. At that time, the problem is sometimes if they don't have cough or good immunity, then they don't feel anything and they will just become a carrier, right? And those who are suffering from it, they might admit to the hospital and came out of hospital. But the problem over here is the post-COVID symptoms. Here what happens that those who have contacted with corona, see, coronavirus lies in initially on our body, then it goes to nose or throat, right? Till then you can definitely control it because you can do some yoga, pranayama, or lemon water, vitamin C, etc. Everything is useful when coronavirus is up to your throat level. But when it goes down to lungs and blood, right, or brain, what happens that if coronavirus goes to lung, there is no other medicine available because you should be on ventilator, and we will expect that your immunity of the body will heal you from corona by making antigens. But this is completely again only based on faith and faith on the body's healing capacity, right? But here what happens actually, when coronavirus in lungs, there is no medicine. When it is in blood, what it will do? It will just make your blood thicker, make clots in the blood, and this clots has it degrades when the body feels recover. Because see, whenever there are clots in the body, when they degrade, then what will happen? It will disintegrate in the blood, and a protein called fibrin will be released in the blood. So if you go for D-dimer test, it will show that the level of D-dimer in your blood. Now D-dimer should be less than 0.5. But there are patients, I am working on few patients who had D-dimer above 5,500 also. And from that my this NLP integrated esoteric architecture, bring them down to level of 100 and then level of 1 and then 0.5. So this is what we can do with NLP integrated esoteric architecture, right? So basically these clots, when disintegrate in the blood, they release fibrin, and so that you can know from the D-dimer test that this patient had some clots in the body. The problem is you don't know the location of the clots. That clots might be in the lungs, or might be in the blood, or from blood it will travel to towards heart also, or towards brain also. So if it will go towards brain, patient will get stroke. And if it will go towards heart, then some problem with heart and attacks, because clot will make some problem there. And if it will go to lungs, then lungs will not be able to breathe easily. And if this condition persists, patient will develop fibrosis in the lungs, and slowly the lungs will become rigid and unbreathable, and then slowly patient dies. So this is very risky pattern. So those who have good immunity and those who do not have good immunity, everybody must take care that you should go for D-dimer test, and you should take care of it, because it is called thrombocytosis. So there should be no clots in your body. Your D-dimer test should be perfectly right. And I am just showing you the testimonial of Dr. Chetan Vyas, who is a ophthalmologist and also an eye surgeon in Amreli, Gujarat, India. He has also contracted from corona and recovered with NLP integrated esoteric architecture. So have a look at it and be careful, be healthy. All the best. Thank you.
Hi, I'm really very happy to share on my experience post-COVID. When I first contracted COVID infection on 20th of November, and 14 days I recovered almost. But after 15 days, I started my job and I felt very tiredness. It was extreme muscle pain in the morning, and really first 1 or 2 hours of the day is really horrible nightmares for me. At that time, I just talked with architecture Hitesh Bhai, and he has done NLP esoteric architecture for me. Within 2 or 3 days, I felt really better, and I am myself doctor practicing ophthalmology, but this experience was wonderful, and I am really happy to share my experience with you. Mr. Hitesh Bhai has done really wonderful things. Thanks a lot.